How can gallstones get complicated and lead to jaundice? I am Dr. Datta Ram. I am a consultant surgical gastroenterologist and laparoscopic surgeon practicing in Hyderabad. Gallstones, as you all know, is a very common problem what we see in our clinical practice. 10 to 15% of the population has gallstones. So many of these patients are asymptomatic. They don't know that they have gallstones, and few of them develop symptoms and complications. So out of which one serious complication is the stones from the gallbladder spilling into the bile duct and causing jaundice and cholangitis and serious other problems. Normally the gallbladder is situated below the liver, and it just does storage function, that it stores bile and it is connected to the bile duct. So what is this bile duct? Bile duct is a channel or a small tubular structure measuring 4 to 5 millimeters in diameter, which transports bile from the liver into the intestine. So the gallbladder is attached to the bile duct through a small channel called a cystic duct. The stones form only in the gallbladder. Stones don't form in the bile duct or inside the liver unless there is some other problem. So when we eat food, the gallbladder pumps bile into the intestine through the bile duct. Stones can also spill from the gallbladder into the bile duct. Many of them may pass off just like that into the intestines. Some may cause pancreatitis, and some may get stuck in the bile duct and cause jaundice. Whenever the stones get stuck in the bile duct, there is blockage to the flow of bile, and the bile starts accumulating in the blood. The patient then develops jaundice, that is yellowish discoloration of the eyes, skin, mucosa, palms and soles. Many a time this may be associated with itching, and patients also experience passing high color or dark colored urine. Sometimes what happens is these patients, because of the high intrabiliary pressure, because of the pressure being high in the bile duct due to obstruction, there is reflux of bacteria and from the infected bile into the bloodstream. So this will cause serious problems. So the patient will start developing fever, high grade fever with chills and rigors, and some of them may develop sepsis, organ failure, multi-organ failure, renal failure, and they end up in a ICU. Somebody developing this problem is called as cholangitis, and cholangitis is a very serious problem. Patients can succumb to this, and this can happen in very fast, especially in elderly people who are diabetics, who have other associated problems. This can be a serious problem. How do we diagnose? Clinical history is very suggestive of the problem what you're suffering from. An ultrasound is the test of choice, which will help us to pick up the stones in the gallbladder as well as sometimes in the bile duct as well, or indirectly it may suggest that the bile duct is dilated, the ducts inside the liver are dilated, etc. Other important test is liver function test, which will tell us the level of jaundice, whether the alkaline phosphate is high, and other parameters. A WBC count. The presence of stones in the bile duct is confirmed by doing a test called MRCP. This is an MRI scan which will tell us if there are stones in the bile duct, and this will help us in managing the patient further. Coming to the treatment of bile duct stones, if the patient is extremely sick, then the patient needs an ICU care. The patient has to be managed in ICU with IV antibiotics to start with, and many of them respond to IV antibiotic therapy and stabilize. And once the patient stabilizes, we may have to do a procedure called ERCP. So ERCP is nothing but it's an endoscopic procedure. It is done to remove the stones from the bile duct. ERCP is endoscopic retrograde cholangiopancreatography. Then this is generally done by a interventional medical gastroenterologist or a surgical gastroenterologist, and the stones are removed by endoscopic method. Once the stones are removed, usually we put a stent inside the bile duct to prevent further obstruction of the bile duct, and you will be advised to undergo a procedure called laparoscopic cholecystectomy. Cholecystectomy is nothing but removal of the gallbladder. Some patients who have neglected stones in the bile duct, large stones in the bile duct, or the bile duct is very big, it has poor drainage, and these patients are ideally dealt with surgical management. That is, the bile duct is big, you can avoid an ERCP and directly go for surgery, surgical removal of the stones from the bile duct, perform a laparoscopic cholecystectomy.